There is a major legal issue lurking in the proposed deal to overhaul George Washington Hospital's patient care. Meanwhile, patients continue to complain about failing services. Our chief legal correspondent, Katie Barlow, has the story tonight from Northwest D.C. So what exactly is going on here, Katie?
Well, George Washington University's Medical Faculty Associates is the largest medical practice group in the district, and they're also deeply in debt, over $400 million, and that's just not sustainable. So to try to preserve access to patient care and accessibility, the majority of doctors with MFA are expected to be employed with Universal Health Services. Universal Health Services is trying to take over MFA. The deal has been in the works for months, and it has caused controversy. A slew of patients have complained about losing multiple doctors and access to timely patient care. Popville featured several patients who say their care has been disrupted. Jen Icovelli says it has been a nightmare for her family. Both her son and husband have cancer. They've experienced delays, trouble getting appointments, and losing doctors unexpectedly because they decide to leave GW.
But our radiation oncologist, when we went for a checkup after my husband completed 28 rounds, she said, okay, this is the last time you guys will see me. I'm leaving. And it's just kind of like when you go through such a diagnosis and a time, it's just been challenging. Getting to talk to anyone, finding out any information.
Yesterday, DCAG Brian Schwab announced a court order that requires GW, MFA, and UHS to provide Schwab's office with all information about the proposed deal. Schwab says he has the power under DC law, the Healthcare Entity Conversion Act, to ultimately approve or reject the deal by September 30th. The problem is the parties dispute Schwab's authority, and there's a real question about what happens if Schwab rejects the deal. It likely means the issue heads to the courts, which could upend resolution for the practice that treats more than 4,600 patients a day. It also leaves patients in limbo. Icovelli says her husband's last day of treatment is the first week of September. She doesn't even know who will get that bill and what to tell her insurance company. UHS said the parties to this transaction continue to maintain that the AG does not have jurisdiction over this transaction. But despite this ongoing objection, the parties have entered into this agreement because the operational close on July 31st is critical to ensuring care. For the sake of transparency, I, like many district residents, receive care at GW, but I haven't experienced those issues. We also got a statement from GW echoing the sentiment they do not believe the AG has jurisdiction to make the ultimate approval call here, but that they plan to work with Schwab's office in the meantime.
All right, Katie, thank you. Let's get to a health alert.